Wake up. It's the Sleep Unplugged podcast, episode 155, Oral Appliances and Sleep Apnea. Put your money where your mouth is. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist, sleep specialist, and your host for this episode of the podcast. If you're new to the Sleep Unplugged podcast family, welcome. If you're a veteran to the podcast, welcome back. We are so glad you're here. If you want to get in touch with the show, you can. Dr. Chris Winter Instagram, Dr. Chris Winter Twitter, Dr. Chris Winter Blue Skies and Threads. There's a YouTube page where we post all the video content of our show that just went over 900 subscribers. We're almost to 1,000, which is really exciting. So if you want to see the video content of the show, you can on there. And every week we typically do comments, corrections, criticisms, and we've got a comment from a listener that we got from the YouTube page. It said, "Hey, the story you did about how pharmacy technicians and even pharmacists themselves treat you when you're picking up controlled substances when you have something like narcolepsy, where you're prescribed various amphetamines and other stimulants to treat your condition so that you can function and have a normal life, is 100% true. I have these 25-year-old kids that treat me like I'm some sort of strung up junkie because I'm picking up a controlled substance when I've been prescribed the same medication by the same doctor for like 16 years. It's not a new thing. It's not like I've been doing it since they were in diapers. And so to be treated so disrespectfully and have someone look down their nose at me because they think they know something about something that they clearly don't know anything about is so condescending, and it can be really humiliating as well. That relates back to our narcolepsy stories that we did. I think it was like episode 97, where we talked about different things that narcolepsy patients went through. And one of them is the stigma of every 30 days having to pick up your, amphetamine, Ritalin, Vyvanse, Strattera, whatever it is, and kind of getting a hard time about it. So I'm glad that resonated with you. I hear you. I don't know why this is such a big deal. I was just talking to a patient this week who was doing okay on a more traditional stimulant as well as modafinil, formerly called Provigil, doing well. And then the nurse practitioner, that's not really a sleep trained nurse practitioner to my knowledge, basically said, "We're going to stop your modafinil because I don't feel comfortable with you being on two different medications." I mean, that should speak volumes. I mean, we put two people on two medications for hypersomnia conditions all the time, just like we put people on two different medications for blood pressure all the time. So we don't want to be cavalier with these medications for sure. But when people need them, they need them. They're not looking to have fun with them, generally speaking. In fact, I think most people who are taking these medications really, really don't care for them. So I really appreciate you reaching out. Anybody who wants to reach out with an idea for the show, a reaction, a correction, whatever it is that you need, let us know. Dr. Chris Winter, Instagram, Twitter, Blue Skies, Threads, all kinds of places where you can communicate with the show. So let's, before we get into it, the lyric for the show, "Put your money where your mouth is." There are a bunch of songs that have that lyric, "Put your money where your mouth is," including Oasis off of their, what was that? "Standing on the Shoulders of Giants." I think there was a song called "Put Your YER Money Where Your Mouth Is." We've already done Oasis. We highlighted Liam Gallagher's solo career. So I thought, well, this would be a good time to spotlight Noel Gallagher's career because he actually had a lyric from a song called "She Taught Me How to Fly" off of his Who Built the Moon album from 2017. That was the third release of Noel Gallagher and the High Flying Birds, which was his sort of solo project. A little trivia about that. I liked the album. I thought his third album was outstanding. That was one of the singles off of it. "She Taught Me How to Fly." Uh, really good. Uh, little trivia about the name of the song. He actually got the name of the group from two groups that sort of inspired him. One was Fleetwood Mac back in the day, before Lindsey Buckingham and Stevie Nicks joined the group. They had a Peter Green was one of their members. I believe he was a founding member. And there was a Peter Green Fleetwood Mac album that called some, it was called something like Peter Green's, and I mean, I can't remember what it was. So he kind of picked up on that as a homage to Fleetwood Mac. And the High Flying Birds is a reference to a classic sort of Jefferson Airplane song. And so that's where the title of his album came. So we'll put on a little Noel Gallagher to round out the Oasis. The other trivia that I just learned, I had no idea. I'm a big NXS fan. I think NXS should absolutely be in the Rock and Roll Hall of Fame. I don't think there's any question. I don't really get what the problem is. Anyway, at some point, Michael Hutchence presented an award to Oasis, sort of towards the later part of NXS's career, earlier part of Oasis's career. Apparently, there was some sort of words exchange about somebody Michael Hutchence was dating. I think Noel Gallagher made some sort of disparaging remarks, so they kind of got into it. But anyway, Michael Hutchence walked out, presented the award, and Noel Gallagher said something like, I don't think has-beens should be presenting awards to gonnabes or something like that. And you can look it up on YouTube. It's pretty direct and pointed. And apparently the legend has it that Michael Hutchence, they were working on their final album. I think the album was titled Elegantly Wasted, as was the lead single off of it, that he went back in the studio and re-recorded background vocals that are not saying I'm elegantly wasted. They're saying we're better than Oasis, which kind of rhymes. So I pulled it up, listened to it, and I'm pretty sure I hear I'm better than Oasis or we're better than Oasis. You kind of like that Daft Punk thing. When you listen to it in different ways, you hear different things. So yeah, so hopefully NXS will get in the Rock and Roll Hall of Fame. I think Oasis, they kind of mended their bridges and calmed down a little bit, but they're still pretty volatile folks. So anyway, let's get into our episode, which is an episode that has come around a lot in my clinic where I'm talking to a patient and say, okay, great. Well, here are some options for your sleep apnea. We could, CPAP, maybe oral surgery, some sort of surgical, including Inspire, which everybody always asks about. And then the third big category of treatment for sleep apnea is oral appliances. Here we are, episode 155, and we're just getting around to talk about oral appliances, which is really inexcusable. But my only excuse is I just find them boring. I think they're great. I think they're important. I don't understand why insurances seem to prioritize CPAP first, then surgery, then oral appliance. That makes absolutely no sense to me. I feel like it should be oral appliance, and then if that doesn't work or not appropriate for it, CPAP, and then if that doesn't work, not appropriate for it, extenuating circumstances, surgery. That would be the order. I'm just in general a guy that likes to go from easier to harder if I can. And the framework that we do oral appliances with in sleep apnea is very skewed. So just to set the stage very quickly, sleep apnea, airway is occluded during the night, obstructive sleep apnea, where we're talking about, where you're sleeping, your airway kind of collapses during the night. And when that happens, you can't breathe. So you wake yourself up over and over, and it creates excessive sleepiness and cardiovascular risk and all kinds of terrible things. So when we talk about treatments for sleep apnea, a lot of people sort of default to CPAP. Okay, well, you have sleep apnea, so you get a CPAP, which is fine. And certainly the most common treatment for sleep apnea, and I would go out on a limb. If somebody disagrees with me, if there's research to say otherwise, I would say that the CPAP is still probably the best treatment for the average sleep apnea patient, all comers, meaning that it's going to do the best job of reducing the number of obstructive breathing disturbances throughout the night. There have been some updated American Academy of Dental Sleep Medicine standards. I think this was this year, that basically said that oral appliance therapy is as a proven effective treatment for sleep apnea and snoring. So that, they're really trying to get the word out there that, look, yes, CPAPs are very important. So are oral appliances. They're proven, they're effective, they can be helpful. There was the first ever joint guideline by the American Academy of Sleep Medicine, which is putting on the big sleep meeting, in addition to the American Academy of Dental Sleep Medicine. It was 10 months ago, basically encourage collaboration and recommends oral appliances for patients intolerant of CPAP or seeking alternatives. There is emerging evidence that shows that these devices may be effective even in some severe sleep apnea cases, although the response is very widely. And when we think about oral appliances, we're typically thinking about devices that advance the mandible. So the most common oral appliances that are out there for sleep apnea today, you wear in your mouth like a mouth guard. They kind of look, I mean, at first blush like a football mouthpiece that you would wear like a football game. But they typically have two trays that are locked in with each other or connected with each other to allow some degree of manipulation. So when you put this oral appliance in your mouth, it typically can be adjusted to make your mandible advance. So that's where the mandibular advancement comes. So if you think about sticking your jaw out like a bulldog, that's an advancement of your mandible. So as you advance your mandible, several things happen. One is you're stabilizing your posterior airway. Second thing is you're making it a bit bigger. So these mandibular advancement devices can be useful in sleep apnea. They can also be useful with individuals who snore, who have primary snoring, or you have snoring and sleep apnea all kind of wrapped up into one. So we think about them very commonly. I think they're really good options for many people. The biggest obstacle often to the oral appliance is cost, which is why I wanted to use the put your money where your mouth is lyric, which again is from a whole bunch of there's a whole lot of songs that have put your money where your mouth is. We chose one. So I think that it starts to become when somebody asks me the question, hey, what medication would you recommend for somebody with narcolepsy? My follow-up question for the questioner is, are we talking about the real world with insurance? Or are we talking about a pretend world that I live in quite a bit where there is no insurance and I can do whatever I want? I love that world. That is one of my favorite places to be. So if it's the real world with insurance, it sometimes can be sticky to get those covered. In fact, my if somebody says, "Do you have the name of a good dentist for an oral appliance?" My metric for good dentist is they're very good at making, adjusting, fitting the technical aspect of the oral appliance. That's part A. Part B is they're good at getting it covered because these devices can be very, very expensive. Every patient that I say, well, refer for an oral appliance, I always ask them, hey, I want you early on in the process to ask this individual, how much is this oral appliance going to cost me out of pocket? How does my insurance handle it, et cetera, et cetera? Those things are extremely important. So who gets oral appliances? I mean, I think anybody can get an oral appliance for sleep apnea. I see a lot of patients who they come to the table, they come to the sleep study, they come to the diagnosis of sleep apnea, having already decided I'm not wearing a CPAP or I can't wear a CPAP. So there's sort of two competing conversations that are going on with that individual. Number one is, yeah, you can. The CPAP is not that big a deal. I say that having worn one for a month just to see what it was like. I say that having spoken and worked with so many people who were initially no way and over time, yes way, easy, no problem. What was I so worried about? So the number of people in our clinic that absolutely cannot wear a CPAP are pretty low, particularly if your provider sort of understands what we talked about in episode 5 of this podcast, that mild sleep apnea. You have 7 breathing problems per hour, and your provider is trying to ram a CPAP down your throat, and you're not feeling that much benefit from it. Of course, you're not, because you only have 7 breathing problems per hour. I only have 3. And what are we talking about here? So I think that's extremely important. So everybody can get an oral appliance. Now, trying the CPAP out first can sometimes be extremely helpful when it comes to your insurance because you tried the CPAP and it wasn't for you, either because you just didn't want to wear it or you couldn't wear it. You were massively claustrophobic, or it hurt your face, or it left indentations on your forehead. Whatever the reason, The failing of the CPAP can often make the oral appliance or the surgery, which we've talked about in previous episodes, a lot easier to get paid for. So when we think about the people who are ideal candidates for oral appliances, we're typically talking about adults with mild to moderate sleep apnea. We're talking about, we always typically think of mild as 6 to 20 breathing problems per hour. Moderate is 21 to 30 or 21 to 35. Some people would say 25, but somewhere in that 20 to 35 range as the max. If you're looking at a sleep study right now and it says 88 breathing problems per hour, you're probably not the right person to look at the oral appliance from the get-go. Now, are there exceptions to that? Sure. Are there case reports of people with really bad apnea responding extremely well to oral appliances? Absolutely. And if you're saying, look, Chris, this is the only option. I can't wear a CPAP. I'm super claustrophobic. And I have met with two ENTs and they say surgery is not for me. Or I'm not a good surgical candidate, for whatever reason. Then I think the oral appliance is absolutely better than nothing. You have a hard time arguing the opposite. I mean, even if somebody had 78 breathing problems per hour, wore the oral appliance, and it knocked it down to 31, that's huge. Do they still have moderate to severe sleep apnea? Yes. 31 is not 3, but it's not 78 either. So, to some extent, like there's the ideal of what we want to do for a patient. Then there's like the reality of a Tuesday, you know, your Tuesday 2:30 appointment who's like, look, my sleep apnea is terrible and I'm not wearing a CPAP. I tried it. I've tried it twice. I tried it with the provider I saw before you. I tried it again with you. I hate it. I keep pulling it off at night. It scares me. It frightens me. It frightens my cat, whatever it is. I'm done with it. Okay, then you're a CPAP failure. Do I have CPAP failures in my clinic? Of course I do. Not a lot, not as many as one might think, but I've got them. So to me, an oral appliance is great, especially if somebody's saying, "Well, I don't know if I want to have surgery." That seems a little extreme to me. Well, yeah, it can be for some people. Now, do I think surgery has a tremendous risk? No, but I think the oral appliance has a lot less risk, if that makes sense. So we're talking about adults who are in that sort of mild to moderate range are ideal. Can you make an argument for somebody with more severe sleep apnea? I think you absolutely can. You need to have somebody who has all this stuff confirmed with a sleep study. More and more dentists are doing their own sort of watch pat, home sleep study kinds of things, and I think that's perfectly fine. These home devices aren't perfect, but they're pretty good, and they don't tend to overestimate sleep apnea. They tend to underestimate it to some extent. So I'm fully in favor of anything that allows an individual to get to a treatment of sleep apnea faster, even if that means bypassing my clinic. I don't think a certified neurologist, sleep specialist needs to see every dental primary care patient who might benefit from a CPAP device. So you have to have good dentition. Most of these oral appliances are to some degree contingent upon your teeth in terms of hanging on to something to, you know, do what they need to do to advance the mandible or, whatever they're going to do. Um, there are some treatments and things in place for kids, but that's a bit more of the exception. So, what are some things that are going to keep you from getting the oral appliance? We've talked about central sleep apnea. Again, central sleep apnea has nothing to do with getting the airway open per se. So the oral appliance is not going to be particularly great for that. People with poor dental health and people with severe sleep apnea, not going to be great. So I want to quickly go through the different types of oral appliances. We've talked about the mandibular advancement devices. There are some tongue retaining devices. The ones I'm familiar with, they look like a little suction cup. Your tongue goes into the suction cup, and it kind of keeps your tongue pinned so it can't fall into the back of your mouth. They're still out there. There are some oral pressure therapy products out there that kind of create a negative pressure in the airway to keep the airway open. And there's some other sort of prefabricated oral appliances that are not as common out there. but can be helpful for some people. I remember one that you put in your mouth that had this little finger on in the back of your throat and literally kind of held your palate up, which always looked like something that was going to, gag you all through the night. So pros and cons. Pros are they're non-invasive, they're easily reversible. There's no surgery, so safer. They're generally pretty comfortable. They can be quite effective. Patients are generally pretty compliant with them. I have a little oral appliance I use through a company called Snore Lab, and it works pretty well in terms of keeping me from snoring when I'm in a hotel room with my partner. So I kind of like that. It's pretty and it's easy for me to manipulate and whatnot. They are not paying me to say that I've done work for them in the past, but our relationship is there is no financial relationship with them right now. Good compliance. People like them. I mean, it's so much easier to travel with this thing if you're looking on the YouTube video than it is to pack up your whole CPAP. Downsides are probably less effective, although, like any technology, they are getting better. Not great for severe sleep apnea. They can cause some jaw pain and discomfort. Sometimes it makes you feel like your teeth are not aligned properly, or over time can actually push your teeth or move your teeth. So you want to be very careful about that. So any appliance you get, either a dentist making it for you, one you got on your own, share this information with your dentist so they know what you're doing and can kind of monitor any changes with your teeth. Ongoing costs. I mean, these devices can be $1,000 out of pocket. You leave it behind in a hotel room or, lose it in airport security. That's not great. So, and I've had patients with bruxism actually bite their way through them. And these are very different from the devices we use for bruxism, just to let you know. Um, Interesting facts. In 2025, research showed that these devices can help some people with severe sleep apnea. That's very variable. There's some emerging teen and tween orthodontic information that's coming out showing that these things can be very helpful. And some of the new devices actually track compliance, which is kind of cool. So if you're a tech person and you like that data, it's great. So just wanted to touch base about oral appliances. Talk to your dentist. They may make oral appliances. If they don't, my guess is the local sleep specialist in your town knows some people. I know people like in Charlottesville. I send people either over to UVA, where they do a very good job of making them. There's a private group in Richmond, Virginia that makes a ton of oral appliances. So I think it's important to make sure that not only does the dentist make them, but has a lot of experience making them. And again, a lot of experience in getting it covered and build. So that's it. Or appliance is done and dusted. I'm going to try to get to Seattle. I'm going to try to figure out if these Oklahoma City Thunder can win game one. I kind of feel like the Pacers may have heard my comments in the last podcast and may have given them some locker room material, but I'm still pretty sure that Oklahoma City is going to win this series. So if you're looking at the video, you can see my hand is not shaking. There is no panic at this point. So good luck to the Thunder and good luck to you if you're looking for a solution for sleep apnea. Give oral appliances a little try, do some research, and hopefully this podcast was helpful. That's it. Done and dusted. Follow me, Dr. Chris Winter. I've books The Sleep Solution, which mentions different treatments for sleep apnea, including oral appliances. We also did The Rested Child, which does not. Follow me on Instagram, Dr. Chris Winter. We are over 275,000 downloads for the podcast, heading to 300,000. I will see you next week for the final episode of the third year of the podcast, live from Seattle. No, it's actually not going to be live, but we'll get a lot of good information out there, do some cool interviews on social media. And until then, sleep well.